Hey GSAC family, we're here with Dr. Louise Gray from Wingfoot Animal Hospital. As you know, she comes in every 2 weeks with us. We have a patient here named Taz.
Say hi, Taz.
Taz, So what's going on with Taz?
Okay, so Taz is in for his wellness check and his allergies. He's got some severe skin allergies. He's seen a lot of lesions on his skin. You probably appreciate the red spot back here on his hind limb, a lot of crust and scales, and some hair loss there as a result of him gnawing and chewing at these itchy spots. So we're trying to figure out what could be the possible rule outs that could cause similar lesions like this. So Mom has been doing her best to try and keep him comfortable using different anti-allergy products, trying to keep the itch. Yeah, it's kind of like a blister, like raised up there. And so far things have not helped. So one of the things we have to first rule out is flea allergy. A lot of people don't realize that dogs and cats can be allergic to flea bites. So even if they're not infested with fleas, if they are allergic to fleas, 1 or 2 fleas can cause them to be extremely itchy to the point that they'll gnaw and chew at themselves and cause lesions. I have not seen any fleas on Taz, but just because I didn't see it doesn't mean that he doesn't have them or that they haven't bitten him. So we have to check with Mom to first of all determine if he is on an effective flea and tick preventative. And the reason I say effective is because not all flea products are made equally. And so you may be using a flea product on your pet and thinking, okay, well it's not fleas because I have them on a flea preventative, but if it's not an effective flea preventative, fleas still may be the instigator or the issue that's plaguing the pet. And so we're going to talk with Mom, find out what she's using, make sure that he is on an effective flea preventative. If he's not, then that's going to be the first rule out. We're going to get him on an effective flea preventative to rule that out as a possibility. But we still have to do something to keep him comfortable. So we're going to try and give him the antihistamine to try and reduce the itchiness. And we're going to recommend a medicated shampoo to help treat the bacterial overgrowth and yeast overgrowth that's
So also question. You said about not being effective. So what kind of time frame should you always look at when you get treatment? Should like a week or 2 weeks or 3
Right,
days?
so if it's an effective flea product, you should immediately see a reduction in the itchiness. Doesn't mean that's going to completely stop, because if they're allergic to flea bites, if you think about how a mosquito bites you, flies off, and then for days later you're still itchy at that spot. So similarly, dogs that are allergic or cats that are allergic to flea bites, once they've been bitten, the damage is essentially done. And the allergen is the saliva of the flea. So once it gets underneath the skin, it's going to cause an allergic reaction for a period of time. And so even after you get them on an effective flea preventative, if they're allergic, you're going to still be a little itchy, but it should be reduced significantly, because the biting action is the thing that initially causes them to be irritated in the first place. So you should definitely see, say if they're a 10 and you give them a flea preventative, it should go down maybe to like a 5 immediately within like less than 24 hours.
So Taz has this issue. He's getting for his vaccination. So is the vaccination still okay to give to him now?
Because he's in all other regards healthy and not having any medical issues aside from his ear infection, we can give him the rabies. Sometimes in December we might hold off on, depending on how severe his allergies are, because we're challenging his immune system. And so sometimes I personally like to defer, like to December, if they're having a severe, allergy reactions, or because he's like a healthy, strong guy, I think he should be okay. But it would be another thing that we can check with Mom and see if she want to hold off and bring it back. It would be a bad idea, because then we could always follow up on his skin, see how he responded to the treatment that we recommended, and if things are improved, then go ahead and move forward with the December at that time.
Okay, now with an ear infection, we know they shake their head, but what symptoms, for those who are watching, who are first-time pet owners, what are some of the symptoms for ear infection?
So very classic symptoms of ear infections for animals, especially in dogs. Head shaking, as you mentioned, scratching. Perfect, great, right on cue. Thank you, Taz. Head shaking, scratching, if you see them taking their hind leg and just kind of batting at their ears, if they're rubbing it on the carpet, Or if you notice any foul odors, if you notice a foul smelling odor, maybe like old gym socks or corn chips or just a not pleasant stench that comes from the ear, you can just kind of do a quick sniff check. And if you smell something that doesn't smell right, then you might want to get it checked. But the other thing is just visually looking. You can see inside his ear, kind of big yawn there, he's got some debris, which is like that dark brown stuff, which should not be in there. But also his ears are a little extra pink. The texture is not nice and smooth. It's a little bumpy and a little rough in there. This ear is a lot more severely affected because it's a very crusty. You can see it's got some dark pigmentation, which suggests he's had a chronic or recurrent issue with his ears. And you can see the difference in how much debris is inside there, how much swelling there is. So that was kind of a good comparison. So both ears are affected, but his left ear is a lot more severe than the right.
Okay, one more question before we let you go. Now, the ear infection at this level, should it be treated by a doctor or is it something you just do themselves?
Absolutely. He needs to be treated by a doctor because you need to put some medication in there that's going to reduce the itchiness, take care of the infection, and help him to be a lot more comfortable.
Okay.
But at home, you can do routine maintenance just to keep the ears clean. You can get an ear cleaning solution. You don't want to use water, especially when you're bathing your pet. You want to be careful not to get water inside the ear because that can actually lead to ear infections. So no water in the ear. Just use a ear cleaning solution. Sometimes you can get the pads that are pre-moistened and you just go in with your finger, not with Q-tips. Definitely no Q-tips on the ears. But you can use your finger with a ear cleaning pad and just kind of scoop out debris. I don't have one now, but I'm just kind of using the motion. But we'll get his ears all cleaned out and then we'll put some medicine in there to make him feel better.
So family, if you have any questions for Dr. Wade, please give her a call at her office, which is 215-224-2764. That's 215-224-2764. She's located at 6701 Waycoat Avenue, and she's by appointment only. By appointment only. So this is GSAC TV. Thank you for watching, and we'll come back another time.